The standard of care of treatment options for advanced fibrosis due to NASH include diet modifications and exercise achieving weight loss. Not only that, but because usually there's what we call the metabolic syndrome, we have to also make sure that the sugar or diabetes are under control, cholesterol under control, the patient's active, high blood pressure is under control. That all is the standard of care to allow the liver to get rid of the fat and then eventually dissolve the scar tissue or fibrosis and start regressing.
The most important thing is to recognize how far advanced the fibrosis is and try to get the patient to understand the importance of changing the rate at which the liver disease is occurring. So if someone has all the features of metabolic syndrome and you can get them to change their lifestyle, improve their weight, keep their blood sugar under control, manage their blood lipids, you may see complete stabilization followed by resolution of the disease. Resolution of NASH occurs when people lose about 8% of their body weight. Resolution of fibrosis occurs when they lose about 10% of their body weight. So lifestyle changes with improving health may have a huge impact on someone's advanced fibrosis. What lifestyle modifications should the patient make? The most important factor is usually dietary change, that is reducing the amount of sugar in their diet and then adding in a certain amount of exercise. Everyone's definition of a lot of exercise is different, but we like to recommend 150 minutes per week. With those changes, I expect to see about 80% of people lose weight initially. Studies have shown that about 20% of people will maintain their weight. And I think a lot of that comes down to the provider encouraging the patient and giving them good advice on how to manage their weight and how to live a healthy lifestyle.
The success rate of lifestyle modifications, if the patient commits, it's start regressing the disease. The problem is that because it's so much on the patient in terms of it's really changing your life and it's not temporary, it's lifelong, it's a big commitment to have from the patient. So we do struggle to have a success in terms of who can achieve the regression because not everybody is able to commit.